Before conducting this interview, I want to give a brief overall of what scoliosis is. So, scoliosis is a medical condition in which the spine curves abnormally in creating an S or a C shape. The most common type of scoliosis to be found in adolescents is your idiopathic scoliosis. This usually appears in your growth spurts before puberty around the ages between 10 and 18. Even though that the cause of scoliosis is unclear, we can conclude that it is mostly caused due to genetics. Scoliosis affects about 2 to 3% of our population, whereas females tend to experience scoliosis in a more severe way than most males do. Scoliosis can appear during your adulthood either as a continuation of childhood scoliosis or in result of an age degeneration in the spine. In more severe cases, the curvature may compress nerves, causing numbness, weakness, or difficulties with walking and balance. A significant curve can even interfere with the function of internal organs such as the lungs. While scoliosis cannot completely be cured, early detection and proper treatment can effectively manage the condition, helping most individuals maintain active and healthy lives. I also want to give a disclaimer that the person who I interviewed allowed me to use them in the video.
Okay, so today I am here with and he is a 19-year-old male who suffers from scoliosis. So, when and how did you find out that you had scoliosis?
Okay, so actually on a trip that me and my dad took to Florida last year, I got a physical done and they were just checking like regular stuff and they just kind of like, they were measuring something and they was like, oh, you have scoliosis. And I was like, oh, I didn't know that. Yeah.
So it was a recent diagnosis that you found out?
Yeah.
Okay. And based on that, did they tell you like the specific type of scoliosis that you have? Or it was just like a brief?
I don't think they did know. It was just like brief.
Because there's about 3 types of scoliosis that you can have. You have your idiopathic scoliosis, your congenital scoliosis, and your neuromuscular scoliosis. So basically the idiopathic scoliosis is the most common one, and it's the one that does not really have like a reason to why it is caused, but it's like the most common one and it's basically found in most adolescents like you. And then we also have the congenital scoliosis, which is rare, and this is where it happens when you are born and the doctor sees that, oh, you have like an abnormality in your spine when you are being born. But this one is mostly rare. And then you have your neuromuscular scoliosis. This is where your muscles and your nerves both like coincide with the skeleton to like form that curve or spine that you have in your body. So those are like the 3 main types of scoliosis that you could possibly have. Yeah. So I would say that you have the idiopathic scoliosis.
That's the first one.
The first one, which is the most common. That's the one you would mostly see. Yeah, it would be the most common one that you would see.
Okay.
Do you experience any pain or discomfort in your back? And if so, where exactly?
Okay, so I definitely experience pain and discomfort every day. Mostly like in my lower back, kind of on my left side, but mainly my lower back. I feel a lot of sport, so it kind of strains it throughout the day.
With the pain in your back, could you elaborate more on what type of stretches you do every day?
Okay, so every morning I don't know the names of the stretches, right? But I think it's a bit backwards. I don't know. Kind of like lie down and raise your upper body, and then there's the other one, I think the downward
see that these stretches help you throughout the day, like especially since you're going to school?
Well, definitely, because some days when I wake up late and I don't have time to stretch, I feel terrible and it really bothers me. Sometimes it makes me feel like sometimes I get tired just because it drains my energy.
So based on what you told me, and you said that the doctor gave you like a brief diagnosis that you have scoliosis. From what you told me, I'd say that your curvature would mostly be on the left side of your back. And since you said it was in your lower back, normally in adolescents, it would be caused in the thoracic region of the back, which is the upper portion up here.
Yeah.
And normally the signs of back pain for the thoracic region in adolescents would mostly be in the lower back area. So, because your scoliosis doesn't really like start to form until you hit your growth spurts. Then this would more than likely happen in puberty.
Okay.
Yeah.
Well, that makes sense because my back when started hurting in high school when I started doing it because I was very short until like third form and I just like grew out of it. And I mean it was good, but at the same time my knees and especially my back started hurting more.
And to make reference, scoliosis is genetically in your family, right?
Yeah, so my dad told me that he actually has a bit of it, and I know his brother, my uncle, has it pretty about as bad as me. He has it hurt, so it's supposed to run on my dad's side of the family.
Okay. So when you went to Florida and they diagnosed it to you, did they give you any medical treatment? And if not, what challenges do you face in your daily life with this skeletal condition?
So medical treatment for scoliosis.
For scoliosis.
No, when I went there it was for a different medical thing. So that was kind of just like out of nowhere. But they didn't give me no treatment or diagnosis or didn't prescribe anything to me.
Did you ask if they could prescribe anything to you, or was it just like an okay no?
It was like an okay moment. Yeah. And you asked how it affects me throughout the day.
Yeah, how does it affect like your daily life? Like, because you're an athletic person, right? So how does it affect you when you're playing sports, or if you're at school, or just doing like normal home activities?
Okay, so I play basketball, and there's some days where because of my back, like you jump on basketball, and I jump pretty high, but some days like when my back hurts, I can't really get on the ground like that, or I can, but it hurts, so I don't. So like some days it affects me and it makes me have to change the way I play, so I don't feel any pain. And aside from sports, sometimes when I sit down too long, it gives me pain. I need to get up, stretch, move around. And it's also hard to sit in one position because I often change positions to get comfortable.
Did you know that people with scoliosis have a harder time to actually be comfortable sitting down for a long period of time? This is mostly because your pelvic girdle, which is your hip bone right over here, it's not made to be sit down. Because since humans are evolving over time, humans were actually made to walk on the ground. So for you with scoliosis, having to sit down most of this time, especially because you go to school, that also impacts your back pain and how your curve may have formed over the past few years since it has started.
Okay, I don't know.
That useful information.
Yeah, thank you.
Anything else that you would like to add on your daily activities?
Anything coaches they don't have back rest. So like, sometimes you saw when you're not supposed to, but sometimes you can help it. So definitely like playing for a while, like playing a long piece, that would, after that, my back would hurt a little bit.
And let's say you're sitting down and you feel your back hurting. Would you instantly try to like fix your posture while you're doing it?
Yeah, I would either, first I would hit like a little stretch, like, this, like, get it to grab, and then I try to sit more straight.
So with this, have you noticed any changes with your height? Like, since you said that in third form you just magically grew,
Yeah.
would you say that your height has been affected in any way?
Not negatively.
Like either negatively or positively?
I
Because you have scoliosis.
don't know because I'm not sure I would have been taller if my spine wasn't curved. But I would say it's the other way around where my growing or being taller, I feel like makes it more of a problem. But I don't know any way that it affects my health directly.
Well, since your spine is like a curve, it basically would affect your height, meaning that even though you're tall right now, like really tall, there would be a possibility that you could have been taller. But because of the curve in your spine, that may make your posture bad, and that it also may affect, like, because normally your spine is not straight. Your spine has a little curve, but that curve is like basically like inwards.
Yeah.
In scoliosis, your spine is like a curve either on the left or on the right, and it can either look like a C shape or an S shape, depending on MRIs, CT scans, X-rays, and all of that.
Yeah.
Yeah. But I can tell you that possibly when you get older, you might see changes in your height, changes in your body posture, and even changes in how you may look physically. Not like how you look physically, like not how you look like with your facial and skin wise, but how you look like with your body. Like when you get older, I'm not saying it will happen to you, but there may be a possibility that your body may snap like this, and you may have to walk like this. Like your body might be look a little bit deformed. I'm not saying that it could possibly happen to you.
So
Your physique, yeah. Okay. What do you do to help improve your situation? Has finding out that you have scoliosis have changed your thoughts on life, or have made you feel sad or more happy?
It's annoying because especially because of basketball, it definitely pisses me off. I don't know what to say that. But it definitely annoys me whenever some days I feel bad and I can't really do nothing about it because there's just some days, even if I stretch, I just don't feel 100%, so I can't perform as good. But knowing that I have it is useful because now I consciously stretch every day because I know I have something and I know I need to do something about it for it not to get worse. So it allows me to handle the situation better.
And that's good, because some people may find out they have scoliosis, may take it in a bad way and say that it's oh, I have scoliosis, so I can't do this, I can't do that, I'm a failure in the world. And it's good that you think positively about it, even though you may have some challenges.
Yeah.
Yeah. Okay. So, do you have any questions for me that you may want to know a little bit more about scoliosis?
Okay, so what risks like for the future? How will this condition affect?
Okay, well, you will obviously be constantly getting back pain. That would be like a given. You can do your stretches to help. One main thing that you could do while you're stretching or while you're exercising is mainly focus on your core. That helps with posture and releasing stress on the spine. So right here, the core, what I mean by core is like your hip muscles, your back muscles, your lower back muscles, and then the back right here of your leg. You know, like it can help release stress from the spine. And another risk factor that you may encounter would be arthritis. You would be more likely prone to arthritis than normal people because the spinal cord is basically like where your nerves, like your nerves meet and they branch out from your body. So your arthritis may more likely occur to you than in other people. If you don't know what arthritis is, it's basically the stiffness in either your hands or your feet that you can't really move your bones here, and they just stay stiff like this. Yeah. And even that you are a piano player, it may influence that too. Because I don't know if you know, but a lot of piano players suffer from arthritis. Yeah. And what I had said earlier about your body structure, your physique, that is also another risk factor that you would be prone to do. I mean, you'd be prone to have.
Okay. Is there like you mentioned developing some illnesses, but is there any other steps that can really fix it?
When you mean fix it, you mean scoliosis?
Yeah.
If you go towards the medical aspect of it, you can choose to do surgery, which there are different types of surgeries that your doctor may like recommend you to do based on what type of scoliosis you have and how the curvature has impacted your body. But one of the most basic surgeries that is most common in adolescents would be where they insert like a screw and rod into your spine that allows it to be a little bit straighter but not completely. And this is why it is not like 100% straight or 100% back to normal is because if you keep on like screwing in a screw and screw and screw into your vertebral column, and as I had mentioned before, your vertebral column is basically like the point where your nerves branches off. So you could end up being paralyzed because of nerve damage if you continue screwing and screwing to keep that vertebral column straight. So there is surgery that you can take that will more than likely help you. And actually a positive side of the surgery would be that your lower back, if the curvature, let's say the curvature is in your lower back would be the strongest part of your body if you were to take that specific surgery. Because other ways that you could have, taken account that you had scoliosis was if you were on brace, but you said that you didn't know of it until last year.
Yeah.
And the brace basically helps because you're growing and all that, the brace basically helps move it a little bit. Yeah.
Okay.
Mm-hmm. You have any more questions?
I don't think so.
Okay. Well, I will want to thank you for your time, for allowing me to conduct this interview.